I am Sydney Thompson, and I'm going to be teaching you about the LGBTQIA community. So who's in this community? This community is also known as the queer community, and it's present in every state and in every zip code. About 8% of the total adult population is in this community. So about 20 million people in America identify as queer or LGBTQIA. But knowing accurately how many people are is kind of difficult because the US Census doesn't ask questions about sexual orientation or gender identity. There's about 65% of queer families that are not raising children and 35% that are, and the average age of a person in this community is about 40 years old. This population is pretty vulnerable for several reasons. Namely, they've dealt with a lot of discrimination, and this has caused a severe case of poverty in a lot of the community. So in this community, they earn about 8% less than the average heterosexual household. And women in this community earn about 17% less than heterosexual women. Even when you compare African Americans, the African Americans that identify as LGBTQ plus, they're more likely to fall within the poverty rate at 30.8% versus their cisgendered heterosexual counterparts, which lie about 5% less at 25.3%. 70% of heterosexuals own their home as compared to the 49 or 50% of queer identifying people. So we can see that there is a significant gap in equity between this population and the general broader population. And one of those effects of the disparities is not having access to adequate shelter or homes. 1 in 4 queer youth are kicked out of their homes after coming out. This puts them at high risk of being involved or exposed to violence. It decreases attendance at school, and it makes healthcare virtually non-existent for them. They're a lot more likely to develop substance abuse and mental health issues. And a survey that was done in a queer community noted that 70% of these youth suffered from depression and 95% of them struggled to sleep at night. 28% of queer youth surveyed admit to using substances to cope, versus the general population of youth, only about 9% admitted to smoke or use other substance to cope. Homeless youth, on top of this, are 2.5 times more likely to abuse some serious drugs like cocaine and meth, causing some serious health issues. And the medical care for the queer community is less than great. Healthcare workers are not educated in queer healthcare needs, which increases stigma and discrimination in the healthcare settings. For example, trans people are not able to get care. A trans man might not be able to get in to see an OBGYN because of lack of training and more confusions between healthcare workers. About 1 in 5 trans men have said that they've been turned away when trying to get in to see their OBGYN for preventative services. On top of that, it's necessary to have access to good care, especially in the queer community, so you can get screening for HIV, AIDS, STDs, other cancer, just to improve the health of this whole community. Healthcare coverage is also discriminatory. For example, testosterone is covered for cisgendered men, but not for transgendered men. And it's pretty well known that the queer community is very hesitant to seek primary care because of negative experiences in the past, just being discriminated against by the broader public. When questioned about this, 75% of lesbians in New York City delayed healthcare due to fear and high costs. Remember, a lot of them don't have access to a lot of money. This is an example. It's Krista and Jamie, and they're a pretty famous couple. They are 2 moms that had a baby, and they wanted to take their baby to the doctor, but the doctor turned them away because he cited personal reasons. He did not religiously believe in their union as wives, and so he refused to treat them. Legislation is really needed to protect the queer population so that these people have equal access to go to the best doctors and are not discriminated against